just get the questions up. Can I get you just to clap once, so we can just sync the audio up after? You can do that whenever. There we go. Where's the clip on? Just under there. Twist it round just slightly the other way. Or just put it maybe a bit more central.
Is that better?
A lot better. There we go. Yeah, that's fine. Okay. Yeah. All right. So start going now. Firstly, brilliant to have you here. Can we just start off with your full name and your job title?
Yeah, my name's Bianca Hewer and I am the head sports therapist at Newport Pagnell Town Football Club.
So firstly, when did you kind of get into the football scene, and more importantly, when did you get into your kind of the scene with all the physio?
An interest in football kind of started with my dad. I'm an only child, so he would take me to games and watch it on TV and get me interested and stuff. Back then the women's game wasn't as developed as it is now, so I never really got the opportunity to play, but I think if times had changed then I would have. And then in regards to that interest kind of then just followed through into my therapy work. And then this is my 12th season, so 12 years ago that I got into football. It was in my third year of uni.
And with the topic of the piece being cardiac arrest in football, can you just explain to us the medical side? What actually is a cardiac arrest?
So cardiac arrest is when the heart stops pumping blood around the body, so it just literally stops. That is ultimately what happens. It's different to a heart attack or anything like that. It literally just stops. So obviously if the heart is stops pumping blood around the body, you're not getting oxygen anywhere. Everything then starts to start failing. So it's really vital that action is taken as soon as.
And what is that action? Why? What do you need to do if someone else is having a cardiac arrest? What's the first port of call?
So first port of call are we talking about a pitch situation?
Yeah, if we're talking on the pitch.
Talking on the pitch, okay. So it would be to recognise what we call the mechanisms of injury. So what's been going on around the player. So as soon as you're running on the pitch, you know what you're going to be prepared for. You've got your defib with you, ideally, and you can start CPR straight away. And then you would get the defib involved. If that hasn't happened already, if you haven't got it with you directly on the pitch, then getting someone to get that and having all of those emergency action plans in place before the game starts, so everyone knows what role they've got to do at what point.
And on from there, why is it so important that, especially in football, the role of the physios, the role of the medics and the doctors, why is it so important to have those pitch side?
Well, ultimately to save lives. The be all and end all, really. If they're not there and you haven't got people that are qualified, then people's lives are at risk.
And have you had any experiences in dealing with people with heart conditions or even a cardiac arrest?
So I haven't had a cardiac arrest, thankfully, but I have had situations where an opposition player went down and had chest pains. So the game had to be stopped. I went on to help their therapist. And then we had to call an ambulance. We got the defib next to us, just in case. And then the ambulance crew came, and once they'd come, we could carry on the game. Another one was a player was on trial with us, and he had a heart defect. As I'd only just met him and got to know his medical conditions, I asked him to get a letter from his consultant just to confirm that he can play, so that we had that backup and I wasn't putting him at risk, putting him on the pitch. Because especially at grassroots level, it's different when you go higher and you go into the professional game. You've got the doctors and you've got everything at hand, but at grassroots or non-league level, there isn't that safety net and that those checks that are done prior to the player playing. So making sure that I had those in place before he could go on the pitch.
Do you think not just doctors but fans and people around the sport, do you think it should be compulsory that CPR is taught, as well as people knowing where defibs are but also how to use them?
Yes. Matter of factly, I think it should be taught in schools. If we're not just talking about in sporting capacity or even just football, we're talking about day-to-day living. No one knows when potentially they could have a cardiac arrest, and I think it should be taught from an early age so that everyone does know it.
And just one last one. As we've already explained, that you've now got a second defib here at Newport Town Football Club. Why is it so important to have not just one but maybe 2 or 3?
So I've got one that follows us around, so I can take it to away games. It's directly with me on the pitch. It doesn't need a code to use, so it's easily accessible. We have another one which is attached, so it's for the community in our facility here. We don't just have Newport Pagnell Town FC use it. There's lots of different versatility, different teams, different sports that use the facility. So having that community one, which is coded, so you have to call 999 to get the code to open the box. But having it on site is so vital because I'm not here all the time, obviously. And we've just had a 4G built, so there's different teams and different clubs using it there. We've got a tennis court, cricket pitches, so having that community, and even people that live close by, they know that there's a community defib here, so if they need to, they can get it while the ambulance is still on their way, en route.
And have you got a message for the English Football League, the whole way down into grassroots, to kind of encourage them to act a bit more or bring more awareness to cardiac arrest in football?
Yeah, I think that every club or facility should have a defib of some kind. There's still not that many around. Obviously, due to the big cases that you hear, like the Christian Eriksen and stuff, it is more widely known, but I still think that there's a lot that we can do. One, to get people trained. One, to just get people's understanding and knowledge better. Knowledge is key and knowledge is power. If we have knowledge and understanding, then there's so many more lives that we could potentially save.
And just to finish, could I get you to look down this camera and just say, there's still time to revive?
There's still time to revive.